An attack on an abortion clinic would most likely be carried out by a/an, a single-issue group. B. Technology terrorist. C. Violent religious group. D. Extremist political group. A single-issue group. All of the following are examples of domestic terrorism: EXCEPTD, A. Oklahoma City bombing, B. Centennial Park bombing, C. World Trade Center attack, D. Atlanta abortion clinic attacks. C. World Trade Center attack. 5. To date, the preferred weapons of mass destruction for terrorists have been A. Nuclear, B. Chemical, C. Explosive, D. Biologic. C. Explosive. D. Naturally occurring organisms that are cultivated in a laboratory. The terrorism carried out by groups that have close ties with the national government is referred to as A. International terrorism, B. State-sponsored terrorism, C. Foreign-funded terrorism, D. Intercontinental terrorism. B. State-sponsored terrorism. Chemical agents are man-made substances that destroy living organisms. A suicide bomber typically uses a blank to achieve his or her objective. A dirty bomb. B. Metabolic agent. C. Incendiary weapon. D. Industrial chemical. C. Incendiary weapon. You should take appropriate precautions while continuing to perform daily duties and responding to EMS calls. B. Receive a call involving multiple patients with similar signs and symptoms. Which of the following is a pre-incident indicator of terrorism? A. Upcoming national summit meeting. B. Explosion reported at the courthouse. C. Increase in violent political activism. D. Sudden increase in calls to 911. C. Increase in violent political activism. Upon arriving at a scene involving a weapon of mass destruction, you should A. Stage upwind and uphill from the incident. B. Move any bystanders away from the scene. C. Don gloves, a mask, and a protective gown. D. Begin functioning as the incident commander. A. Stage upwind and uphill from the incident. A. Optimal route of approach. D. It takes time for the hazardous materials team to assemble their personnel and equipment. B. Locate the medical staging officer to receive your assignment. When triaging patients at the scene of an explosion, you should be especially aware of the fact that the terrorist may still be present at the scene. B. A secondary explosive device may be present. C. Wind direction and speed may change quickly. D. Many explosions involve radioactive material. B. A secondary explosive device may be present. D. Can remain on surfaces for long periods of time, usually longer than 24 hours. C. Burn like blisters to form on the skin and in the respiratory tract. 20. All of the following chemicals are vesicant agents: EXCEPT, A. Chlorine, B. Lewisite, C. Phosgene oxime, D. Sulfur mustard. A. Chlorine. Gray discoloration of the skin is a sign of permanent damage seen following exposure to a lewisite and phosgene oxime. B. Chlorine and sulfur mustard. C. Phosgene, soman, and harpoon. D. V agent and sulfur mustard. Aluicite and phosgene oxime. B. The patient experiences a progressive reddening of the affected area, which will gradually develop into large blisters. In contrast to sulfur mustard, aluicite, and phosgene oxime exposures, A. do not result in the formation of blisters. B. have a delayed onset of signs and symptoms. C. cause a change in the structure of the cells. D. cause a rapid onset of signs and symptoms. D. cause a rapid onset of signs and symptoms. C. No antidotes exist for sulfur mustard or phosgene oxime exposure. 25. Initial exposure to blank produces upper airway irritation and a choking sensation. As soman, B. chlorine, C. phosgene, D. phosgene oxime. B. Chlorine. A phosgene is a product of combustion, and may be encountered at a fire involving a textile factory or the burning of freon. Nerve agents block blank, an essential enzyme of the nervous system. A. Epinephrine, B. acetylcholine, C. norepinephrine, D. cholinesterase. D. cholinesterase. C. Its vapors are continuously released over a period of time. In contrast to sarin, soman, A is much less persistent and is odorless. B is 5 times as lethal and has a fruity odor. C is a clear, oily agent that looks like baby oil. D enters the body exclusively through the skin. B is 5 times as lethal and has a fruity odor. B. harpoon has a fruity smell and an appearance similar to sarin. D. so persistent that, given the proper conditions, it will remain relatively unchanged for weeks to months. Signs and symptoms of nerve agent exposure include all of the following: except, tachycardia. B. bronchuria. C. constricted pupils. D. excessive salivation. Tachycardia. The seizures associated with nerve agent exposure, A. cannot be reversed with any pharmacologic agent. B. are often more severe in patients with a seizure history. C. will continue until a MARC1 antidote is administered. D. should be treated with large quantities of a benzodiazepine. C. will continue until a MARC1 antidote is administered. MARC1 and duodot antidote kits contain a lorazepam and 2-pam chloride, B. midazolam and atropine sulfate, C. atropine and pralidoxime chloride, D. pralidoxime chloride and epinephrine, C. atropine and pralidoxime chloride. B. the onset of symptoms following exposure is immediate. The symptoms and medical management of patients poisoned by blank are identical to those of the nerve agents. A cyanogen chloride, B. organophosphate insecticides, C. pulmonary or choking agents, D. phosgene oxime and aluicite. B. organophosphate insecticides. Signs and symptoms of significant cyanide exposure include tachypnea, B. bradycardia, C. hypertension, D. hot, dry skin. Tachypnea. D. Generally resolved by simply removing the victim from the environment and administering oxygen. Which of the following chemical agents has the smell of freshly cut grass? A. Tarbundiluicide. C. Phosgene. D. Hydrogen cyanide. C. Phosgene. C. The patient may be contagious despite the absence of signs and symptoms. Smallpox is in its most contagious phase when a rash develops. B. Blisters begin to form. C. The patient becomes febrile. D. A headache and body aches develop. B. Blisters begin to form. In contrast to the lesions associated with other skin disorders, the lesions associated with smallpox, A, are identical in size and shape. B. Remain isolated to the facial area. C. Originate on the lower extremities. D. Are in various stages of development. A. Are identical in size and shape. If an outbreak of smallpox were to occur, vaccinations would be offered to anyone at risk of infection. B. Emergency personnel only. C. The entire U.S. population. D. Immunocompromised people only. Anyone at risk of infection. A terrorist would most likely disseminate smallpox via a powder. B. An explosion. C. A dirty bomb. D. Aerosolization. D. Aerosolization. 45. Signs and symptoms of smallpox generally appear within blank days following exposure. A 2 to 5 bite, 7 to 9, C 10 to 12, D 14 to 16. C 10 to 12. Viral hemorrhagic fevers include all of the following: EXCEPT, Ebola. B. The plague. C. Rift Valley. D. Yellow fever. B. The plague. Infection with the Ebola virus is characterized by a progressive onset of high fever. B. Internal and external hemorrhage. C. The formation of cutaneous blisters. D. Paralysis of the respiratory muscles. B. Internal and external hemorrhage. A lies dormant in a spore and is released when exposed to the optimal temperature and moisture. Although blank anthrax is the most deadly, blank anthrax is the only form that is communicable. A. Cutaneous, inhalation. B. Gastrointestinal, pulmonary. C. Cutaneous, gastrointestinal. D. Pulmonary, cutaneous. D. Pulmonary, cutaneous. 50. Bubonic plague is also referred to as plague pneumonia. B. A highly communicable bacterial disease. C. Characterized by lymph node enlargement. D. More contagious than pneumonic plague. C. Characterized by lymph node enlargement. In contrast to viruses and bacteria, neurotoxins, A. can only enter the body through the inhalation route. B. Are characterized by a slow, insidious onset of symptoms. C. Are not contagious, but do have a faster onset of symptoms. D. Have been used successfully as a weapon of mass destruction. C. Are not contagious, but do have a faster onset of symptoms. Ricin is a neurotoxin that is derived from a synthesized virus or bacterium. B. Mesh that is left from the castor bean. C. The leaves of the purple foxglove plant. D. The seeds from a wide variety of fruits. B. Mesh that is left from the castor bean. Which of the following statements regarding ricin is correct? ricin is 5 times more lethal than botulinum. B. Ricin is highly communicable only if it is inhaled. C. Calcium chloride is the preferred antidote for ricin. D. Ricin is extremely toxic by many routes of exposure. D. Ricin is extremely toxic by many routes of exposure. Whether ingested or inhaled, ricin poisoning causes a fever, chills, and a headache. B. A productive cough and diaphoresis. C. Convulsions, cyanosis, and hemorrhage. D. Chest pain, muscle aches, and pulmonary edema. A fever, chills, and a headache. 55. Which of the following biologic agents is highly transmittable from person to person? A. Smallpox. B. Botulinum. C. Bubonic plague. D. Yellow fever virus. A. Smallpox. When conducting syndromic surveillance, patients who present with signs and symptoms of blank are especially significant. A. Hepatitis B. Influenza. C. Renal failure. D. Food poisoning. B. Influenza. C. Pre-established facilities for the mass distribution of antibiotics, antidotes, vaccines, and other medications and supplies. In contrast to alpha radiation, beta radiation, A is easily stopped by a piece of paper. B travels slowly and is less penetrating. C can easily penetrate the human body. D requires a layer of clothing to stop it. D requires a layer of clothing to stop it. Blank is/are the fastest and most powerful form of radiation, and can easily penetrate through lead. A. Alpha rays. B. Beta rays. C. Gamma rays. D. Neutron energy. D. Neutron energy. B. An RDD is any container designed to disperse radioactive material, and requires the use of an explosive device. The destructive capability of a dirty bomb is limited to the explosives that are attached to it. B. Sufficient to injure thousands of people. C. Directly related to the radioactive material within it. D. Not affected by the presence of radioactive material. Limited to the explosives that are attached to it. A. Remote because other nations do not have the ability to deliver a nuclear weapon via missile or bomb. Radiation exposure that occurs through the body is most appropriately termed a infection. B. Absorption. C. Irradiation. D. Internal contamination. C. Irradiation. Common signs of acute radiation illness include all of the following: except, a nausea. B. Hair loss. C. Vomiting. D. Diarrhea. B. Hair loss. D. It is impossible to recognize the type of radiation emitted from a given source. B. Use time, distance, and shielding to your advantage. A. Stay where you are until you receive instructions from the staging officer. C. Remain alert to the possibility of a secondary explosive device. C. Ensure that the patient has been decontaminated before initiating any treatment. B. Phosgene. B. Assisting is ventilations with a bag mask device, and 100% oxygen, performing intubation if necessary, establishing vascular access, applying the cardiac monitor, and administering atropine and pralidoxime. D. Rash and blisters on her face. A. Anthrax.